When we ended last time, we were looking at a posterior view of the external anatomy of the heart. In this figure, we can see the left atrium, the right atrium, the left ventricle, and the right ventricle. The chambers of the heart are bounded by grooves known as sulci, of which there are three. An anterior view of the heart shows the atrioventricular coronary sulcus, which separates atria and ventricles. Then we have the anterior interventricular sulcus, which overlies the interventricular septum that divides the right ventricle from the left ventricle. These sulci are filled with fat and coronary blood vessels. A posterior view of the heart shows the posterior interventricular sulcus, which separates the right ventricle from the left ventricle. The walls of the atria are thin and flaccid because they do less work and are separated by an interatrial septum shown here. The right atrium contains ridges known as pectinate muscles. These pectinate muscles are found in the right atrium and also in both the right and left auricles. A more muscular septum is the interventricular septum, which separates the right ventricle from the left ventricle. The ventricles also have ridges, and these ridges are called trabecular carneae. These ridges help to keep the walls of the ventricles from collapsing or clinging to each other after contraction. At the base of the heart, you have your great arteries and veins attached. These are your large blood vessels are attached to the base of the heart. We have the superior vena cava, which brings blood from the head and neck regions, and the inferior vena cava, which brings blood from the lower extremities and deposits it into the right atrium. So blood comes from both the superior vena cava and the inferior vena cava, and that blood is deposited into the right atrium. Note, it's the blood that is deposited into the right atrium is deoxygenated blood. We have the aorta, and the aorta has an ascending part, so this is the ascending aorta. Then you have the aortic arch, and then the descending aorta. And the aorta takes blood from the left ventricle, and that blood is pumped into the aorta, and the aorta then sends it to the entire body. Then we have the pulmonary trunk. The pulmonary trunk is attached to the left atrium. The pulmonary trunk is attached to the left atrium, and the pulmonary trunk is attached to the right ventricle, and blood from the right ventricle moves into the pulmonary trunk. That trunk is then divided into the left pulmonary artery and the right pulmonary artery, and that blood then goes to the lungs. Again, that's deoxygenated blood from the right ventricle moving into the pulmonary trunk, which divides into the left pulmonary artery and the right pulmonary artery. That blood then goes into the lungs, where it collects oxygen, picks up oxygen, and then returns to the heart via the pulmonary veins. You have the left pulmonary vein and the right pulmonary vein. So you now have oxygenated blood from the lungs entering the heart, and it enters at the left atrium. enters at the left atrium. So again, these are the great arteries. We have the superior and inferior vena cava. Then you have the aorta, the pulmonary trunk, which divides into the left and right pulmonary arteries, I'm sorry. And then we have the left and right pulmonary veins. Here's another view of those great arteries and veins. Superior vena cava, inferior vena cava deposits blood into the right atrium. Then the pulmonary trunk, which takes blood from the right ventricle and sends it into the left and right pulmonary arteries. Then we have the pulmonary veins, which brings deoxygenated blood from the lungs. We have the left and right pulmonary veins bringing oxygenated blood, from the lungs and deposits that into the left atrium. Then the left ventricle sends blood into the aorta, and the aorta takes that blood. Again, oxygenated blood is sent from the left ventricle into the aorta, and that blood is then sent to the entire body. In the heart, we have valves. There are two sets of valves, and the purpose of the valves are to ensure a one-way flow of blood, so that blood moves in one direction and there's no backflow of blood. So we have the atrioventricular valves, which are located between the atrium and the ventricle. So here we have on the right side the right atrioventricular valve, also known as the tricuspid valve. And then we have the left atrioventricular valve, known as the bicuspid, or sometimes referred to as the mitral valve, which is located between the left ventricle and the left atrium. These valves are called tricuspid and bicuspid because of the amount of cusps that they contain. So the tricuspid valve has 1, 2, 3 cusps, and these cusps are attached to muscles known as papillary muscles located on the floor of the ventricles, and these papillary muscles are attached to the cusps via cords known as chorda tendineae. On the on the left side, we have the bicuspid valve, which has 1, 2 cusps attached via chorda tendineae to the papillary muscles in the left ventricle. Another pair of valves are the semilunar valves, and the semilunar valves are the pulmonary semilunar valve and the aortic semilunar valve. The pulmonary semilunar valve is located between at the base of the pulmonary trunk and the right ventricle. The aortic semilunar valve is located at the base of the aorta and the left ventricle. Here's a superior view of the valves. So this is the heart with the atria removed. So you're looking down into the ventricles, and you can see the right atrioventricular valve, or the tricuspid valve, the left atrioventricular valve, or the bicuspid valve, also the mitral valve. Then you have the aortic semilunar valve and the pulmonary semilunar valve. Here's another view of the aortic semilunar valve, and you can see the cusps of that valve. Here's a tricuspid valve, and recall the tricuspid valve is located on the right side of the heart. It's an atrioventricular valve located between the right atrium and the right atrium and the right ventricle. Here we can see the papillary muscles, which helps to anchor the chorda tendineae, which is attached to the cusp of the valve, and that anchors the cusps to the papillary muscles, which are located on the floor of the ventricles. Blood flows through the heart valves according to pressure gradients. When the ventricular pressure is less than the atrial pressure, blood flows from the atria into the ventricles. So blood flows from an area of high pressure, to an area of low pressure. High pressure to low pressure. So again, when the ventricular pressure is less than the atrial pressure, the ventricles will relax and blood will flow into the ventricles. When the ventricular pressure is greater than the atrial pressure, then the atrioventricular valves will close shut, as you see here. Atrioventricular valves will close and the ventricles will begin to contract. When the pressure in the ventricles are greater than that in the arteries, the great arteries, then the ventricles will contract and push that blood into the pulmonary trunk from the right ventricle and into the aorta from the left ventricle. When the ventricular pressure is less than the pressure in the great arteries, then the ventricles will relax. Okay, so now let's look at some valvular disorders. These are called valvular insufficiency disorders. One is known as valvular stenosis and the other is mitral valve prolapse. Valvular stenosis is when the cusps of the valves are stiffened and the opening is constricted by scar tissue. This is can be caused by rheumatic fever, which is an inflammatory disease that can involve the heart, joints, skin, and brain. This disease typically develops 2 to 4 weeks after a streptococcal throat infection. So after strep throat, if it's not treated, one can develop valvular stenosis. Valvular stenosis can also be caused by an autoimmune attack on the mitral and aortic valves. The effects of valvular stenosis is enlargement of the heart and also a heart murmur. Heart murmurs is a sound that can be detected using a stethoscope, and it actually represents a backflow of blood. If you recall, valves are supposed to allow for blood to flow in one direction, but when the cusp of the valves are stiffened and are constricted, it causes blood to flow backwards, and that's detected as a heart murmur. Valvular stenosis is treated with blood thinners or a replacement of the valve. Then there's mitral valve prolapse, where the mitral valve cusps bulge into the atria during ventricular contraction. This can be caused by the cause of this can be hereditary, so you can inherit it from your parents. However, it's not serious, but it may be associated with chest pain and shortness of breath, and treatment is usually not necessary. So in summary, let's look at the flow of blood through the chambers, and it's important that you know this slide. So blood enters the heart through the right atrium from the superior and inferior vena cava. That blood then flows from the atrium flows from the right atrium into the right ventricle. That blood then flows from the right ventricle into the pulmonary trunk, which divides into your left pulmonary artery and your right pulmonary artery. It then moves to the lungs, picks up oxygen. That oxygenated blood then re-enters the heart, or enters the heart via the left pulmonary vein, the right pulmonary vein. That's then deposited into the left atrium, and then that blood then flows into the left ventricle. From the left ventricle, blood is pumped into the aorta, and from the aorta, it spreads to the rest of the body.